Good evening, everyone. Today I'm going to explore a topic that may seem controversial at first glance. However, it has the potential to revolutionize how we treat one of the most challenging mental health conditions, post-traumatic stress disorder, or more commonly referred to as PTSD. Today, I will be talking about the benefits and fallbacks of psychedelic-assisted therapy. Now, when you hear psychedelics, your mind might jump to the counterculture of the 1960s, or you may think of the illegal recreational use of drugs today. But what if I told you that these powerful substances, when used in carefully controlled therapeutic settings, could offer a hope to those who have found little relief from other traditional treatments or medications? PTSD affects millions worldwide, including veterans, survivors of abuse, and those who have experienced other forms of trauma. It can be described as a debilitating condition and resistant to other conventional therapies and medications. This is where psychedelic therapy enters the picture. It offers a novel approach that combines the use of certain psychedelic substances with psychotherapy to potentially reset the brain and allow for a more profound healing experience. Before we dive into the specifics of psychedelic therapy, it is crucial to understand that this treatment procedure is fundamentally rooted in a trauma-informed approach. This means that the treatment recognizes both the widespread impact of trauma, as well as understanding all potential pathways for recovery. Additionally, there is an added emphasis on ensuring therapy is not re-traumatizing the victim during the use of psychedelics. In psychedelic therapy, the trauma-informed approach is evident in every aspect of the treatment. As one author explains, the role of MDMA is to create a mental and emotional state conducive to fuller engagement in a therapeutic process. This isn't about using drugs to escape reality, but rather to create a safe space where patients can both confront and process their traumatic experiences. This setting is carefully designed to be both clinical and aesthetically pleasing, with each session lasting on average 5 to 8 hours. Patients are accompanied by trained therapists whose role is to facilitate an introspective process on themselves and their trauma. This approach emphasizes allowing the patient's own healing process to unfold, rather than forcing a particular narrative or interpretation on the patient. Importantly, the trauma-informed approach extends beyond the psychedelic sessions themselves. There are typically several non-drug preparatory sessions before the psychedelic experiences and multiple integrative therapy sessions afterwards. This comprehensive approach ensures that patients are both well prepared for the experience and have the support for processing and integrating their insights afterwards. Now, let's look at what research tells us about the effectiveness of psychedelic therapies for PTSD. The most studied psychedelic for this purpose is MDMA, which is also commonly referred to as ecstasy. While it is important to note that this is not the same as the street drug, which can be adulterated and dangerous. What patients are taking is a pharmaceutical-grade MDMA, which is used in clinical settings and has showed promising results in the past. A phase 3 clinical trial led by researchers at the University of California found that MDMA-assisted therapy significantly reduced PTSD symptoms. According to the lead author, more than 71% no longer met the criteria for PTSD diagnosis, compared to the 48% in the placebo group. Now, this is a remarkable improvement over traditional treatments. What is particularly exciting is that these benefits seem to be long-lasting. Unlike many psychiatric medications that need to be taken daily, MDMA-assisted therapy typically involves just 3 dosing sessions over the course of 3 months, along with the preparatory and integration therapy sessions before and afterwards. This is not just MDMA that's showing promise, though. The active drug psilocybin, which is commonly found in magic mushrooms, is also being studied for its potential in treating PTSD and related conditions like depression. A large phase 2 trial found that a 25 milligram dose of psilocybin with psychotherapy was associated with a rapid and sustained antidepressant effect. These clinical outcomes are encouraging, but it is important to remember that psychedelic therapy is not a magic bullet. It is a powerful tool that, when used in conjunction with skilled psychotherapy, and can catalyze healing processes that might otherwise take years of traditional therapy. While critical data is crucial, it's equally important to consider the subjective experiences of the patients themselves undergoing these types of treatment. Many describe these sessions as among the most meaningful experiences of their lives. Patients often report a sense of safety and openness that allows them to confront traumatic memories without being overwhelmed by the fear or anxiety. As one MDMA-assisted therapy participant describes, maybe one of the things the drug does is let your mind relax and just get out of the way. For many, the psychedelic experience provides a new perspective on their trauma. They see it as a part of their story rather than a defining feature of their identity. This shift in perspective can be profoundly healing. Importantly, patients often report increased sense of connection. This is either to themselves, to others, or just to the world around them. And this sense of connection can be particularly healing for some trauma survivors who often feel isolated or disconnected due to their experiences. However, it is crucial to note that these experiences can also be challenging. Patients may confront difficult emotions or memories during these sessions, and this is where the skill of therapists and the importance of integration work becomes very clear. As one author explains, the patients are confronted with something dark about themselves. They need trained professionals to create an environment of both love and protection during this process. While the potential for psychedelic therapy is very exciting, it's not without its challenges and considerations. First and foremost, these substances are still classified as a Schedule I drug in the United States and are equally as illegal in Canada. Now, this has made research challenging and limited due to the hard access of getting these drugs. There are also some very important safety considerations and concerns. While psychedelics have been shown to be psychologically safe when used in a controlled setting, they can still pose psychological risks, particularly for individuals who have a history of psychosis or other certain mental health conditions. Another challenge is ensuring equal access to these treatments. As an author points out, we do not want this drug to be exclusively for the white upper middle class. Cost is a significant factor here, with current estimates of a course of MDMA-assisted therapy running around $12,000 per participant. There is also the question of integration. While the psychedelic experience itself can be profound, the real work happens in the days, weeks, and even months that follow after the patient's work to reintegrate their insights into their daily lives. This requires ongoing therapeutic support and a commitment from the patient to continue their healing journey. Finally, there's a need for trained professionals. As another author at the Hopkins University notes, thousands of doctors, nurses, and psychologists will be lining up to practice with these drugs who have not been trained to use them. And the healthcare system needs to prepare for this unprecedented change. Despite these challenges, the future of psychedelic therapy does look quite promising. We're likely to see an FDA approval of MDMA-assisted therapy for PTSD in the near future, which would mark a significant milestone in the field of mental health treatment. Research is also expanding beyond PTSD. Studies are underway exploring the potential for psychedelics for treating depression, anxiety, addiction, and even cluster headaches. We're also seeing increased interest in combining psychedelics with other therapeutic modalities, such as cognitive behavioral therapy or mindfulness practices. As research progresses, we're likely to gain a deeper understanding of how these substances work in the brain. This could lead to development of new compounds that retain the therapeutic benefits of psychedelics while minimizing potential risks. There are also growing interest in the role of setting and context in psychedelic therapy. Traditional indigenous use of these substances have always emphasized the importance of ceremony and community. As Western medicine embraces psychedelic therapy, there is an opportunity to learn from these traditional practices while maintaining a scientific. In conclusion, psychedelic-assisted therapy represents a paradigm shift in how we approach the treatment of PTSD and other mental health conditions. By combining these powerful psychedelic experiences with skilled psychotherapy, we have the potential to offer a new hope for those who have found little relief from traditional treatments. However, it is crucial that we proceed with caution and with respect. These are powerful tools that require careful handling. As we move forward, we must prioritize safety, ensure equal access, and continue to refine our understanding of how best to use these remarkable substances. The renaissance of psychedelic research is not about returning to the turn on, turn in, tune in, drop out ethos of the 1960s. Instead, it is to harness these compounds' potential in the responsible, scientific manner to alleviate suffering and promote healing in patients. As we stand on the brink of this new frontier in mental health treatment, I'm filled with hope. For the millions suffering with PTSD who may soon now have a new option for healing. For hope for a more nuanced understanding of consciousness and its role in mental health. And hope for a future where we can offer truly transformative treatments for